everybody, thanks for joining me today. Dr. Ross Marcogiani with another great conversation at Turnpaugh Health and Wellness Center. Today we're going to be diving into molds and mycotoxins. We'll be talking about what are molds and mycotoxins, how does this affect our body and how does someone get mold and mycotoxins, signs and symptoms of mold and mycotoxin toxicity, how we test for it, and how we remove molds and mycotoxins. Let's dive in. So what are molds and mycotoxins? Well, first off, molds are types of fungi that produce spores. These fungi or spores grow best in dark, warm, and damp environments. So that's something to be really aware of. But they're basically fungi that have developed spores. And mycotoxins are basically they're secondary metabolites that are produced by fungi or micro-fungi. So think of mycotoxins as baby molds. Basically, they're produced by molds. Also, there's some things to be aware the connection here when we're talking about mold and mycotoxins is things called spores. Spores basically are produced by the mycotoxins and can basically be launched into the air, can travel, and then can basically implant itself and grow into a mold or a mycotoxin. So something to be aware of that. Another thing that you're going to hear about when talking about this topic is aflatoxins. Aflatoxins are part of the mold and mycotoxins, and they are basically substances that live on the mold mainly. They actually live on the mold or live on the mycotoxin. So when we talk about mycotoxins in molds, we have to at least mention aflatoxins and spores, mold spores. So that's a really common misconception here. Just because someone doesn't see mold doesn't necessarily mean 100% you don't have mold. Mold or mycotoxins can travel in a spore form in the air, and we can have exposure without actually physically seeing it. It can be in the air. And really important here that we establish a primary pathogen versus an opportunistic pathogen. So we can have primary mold pathogens. As you can see here, there are some examples here that can create cancer and serious infection and disease. There are opportunistic pathogens, which we're mainly going to talk about today, that can really affect people who are immunocompromised. So the individuals who are immunocompromised are going to be more susceptible to these opportunistic pathogens. It's important to be aware of both of them, but most commonly we're seeing opportunistic pathogens or molds and mycotoxins have the greatest effect on individuals. So how does this affect our body? So basically we can see here the major ways is that we're going to be unable to remove the toxin. We're going to have cytokine accumulation, which is going to drive inflammation and then further drive immune dysregulation. Give me 1 second, I'll explain that in a little bit more detail, but also really important that again, we can be infected or exposed to these mold, mycotoxins, aflatoxins, and spores by various pathways. So, or various exposures by breathing in these spores or molds or fungi, by dermal contact, and by food contamination. So it's something to be aware of. So how does this affect our body? I know this is really a lot of information here, and this is going to be a shout out to Dr. Shoemaker, Richie Shoemaker, who is kind of at the mecca of the mold information and mold issues. So this is a lot of this information is researched, or I've followed up through him as well. His information that he's lent to the public. But this is a diagram. I don't want you to get too complex, but the main thing is I want you to see here is that we have a biotoxin. And the biotoxin, as we go straight across the diagram here, the biotoxin basically releases a cytokine response, okay? This cytokine response is our immune system saying something's going haywire, something's not right. So this then will drive, as you can see here, inflammation in the orange, and then in the yellow, further immune dysregulation. And this can drive a lot of the symptoms that we'll be talking about in just a moment here, but this is really the main pathway. There's a lot of other things that will follow with this, but it's really important to realize that we have this exposure, this biotoxin exposure, whether it be a mold, mycotoxin, spore, aflatoxin, and then we drive this cytokine response because the body's trying to help to get rid of this, and then we further cause immune dysregulation and we further cause inflammation. So signs and symptoms. I'm not going to go over every one here. You can see there's a lot of signs and symptoms associated with mold and mycotoxins, but the real big ones to be aware of: severe brain fog, severe depression, mood disorders, anxiety. These are all things that can really be common in mold disease or mold exposure, we can really have an effect on the gut because certain molds and fungi can create filaments or microtubules that actually punch holes into the gut lining. We'll talk about that in a moment. We can, for the brain, when exposed to molds, can actually punch holes into that blood-brain barrier in the brain. That's why we'll talk about with one of our repair methods is using choline. I specifically like to use phosphatidylcholine to help repair that. But these are some common signs to be aware of and to take notice of if you're thinking, mold might be one of your issues here to address. Here's a helpful chart here. This just shows, again, I'm not going to go through all of this, but this shows various molds and mycotoxins, and and foods that are associated with this mycotoxin, and then the immune response or the physiological response that can emanate or basically take on form when constant exposure to this mycotoxin. So real quick, we have the aflatoxin. You can see beans, corn, rice, some other foods, and it creates a lot of liver damage here with long-term exposure. We got ochratoxin, some cereals and grains. This can create a lot of blood sugar instability, kidney issues, neurological issues. Then we have our steri here. We can large exposure to dust. Again, this can have GI issues, liver issues, possible cancer issues. Then we have the ZIR here, which is wheat, barley, rice, corn. Those are some other common exposures. Hepatotoxicity, hemotoxicity, genetotoxicity, so even changing our genetics, being aware of that. Then we have the inhalation, the cereal grains, our exposure to, and then mitochondrial deficiency, being aware of that. Then we have the trichothiones, water damage is going to be the big one from this, and this can create severe neurological issues, and along obviously other issues here as well. So something to be aware of, and I wanted my viewers to be able to see this. So testing, what testing can we do here? Big one is going to be the GLP, Great Plains Labs, mycotoxin testing. That's a really good one that I use very regularly. We can do an ERMI, that's an environmental relative mold index test, and then the HERT SMI2, it goes hand in hand. So basically the ERMI basically shows how many, the level of mycotoxins in the environment in your home, and then the HERT SMI2 basically takes the 5 most common ones, or excuse me, the 5 most elevated mycotoxins, and it further evaluates them there. But I would definitely start with the ERMI. We can also do some blood testing here. The big ones that I want to talk about, the tests that kind of tie into some of the physiology, is the leptin and the melanocyte stimulating hormone. That's the MSH there. So what happens here, we talked about the release of those cytokines, right? The immune response. Well, what happens is the cytokines will bind to the leptin receptors in the brain, and therefore the leptin receptors can't bind and can't be used up. So we'll have a lot of leptin circulating in the blood. And also when we have that process happens, that all happens in the hypothalamus in the brain. When that happens, we're unable to release melanocyte stimulating hormone from the hypothalamus. And MSH will be affected because we can't release the MSH. So we'll see leptin go up very commonly, and we'll see MSH go down. You'll see VEGF go down, MMP9 will start to go down, your TGF-beta will start to come up because, again, we're in more inflammation. Another test is a neuroquant. This is something that we can do. This is an MRI that hasn't been solidified, but has been showing to have some legitimacy in evaluating mold exposure. But I would definitely do the earlier mentioned rather than the latter in the process of testing. And then obviously making sure if we are testing, we'll talk about some good remediation methods here. So how do we remove these toxins? So really important, proper remediation if we have mold exposure. It may be to the point that you need to leave your home or sell the home. In some situations, it may need to be taken to that extent. But you want to make sure you look into a good remediation and get good pricing for that as well. Some really good labs, or excuse me, some really good remediation companies are Aerobiological Solutions and Aerosolver are going to be really good labs. That's two labs that, or remediation companies, excuse me, that Dr. Shoemaker recommends. Also, we want to make sure if we're suspect or suspicious of mold, again, you don't need to always see it, we don't need to always smell it, but getting rid of your rugs, getting rid of the old blankets, the teddy bears, assessing your pillow, making sure we're changing pillows, assessing your bed, maybe removing and getting rid of your bed, looking at furniture that you've had for excessive periods of time, and then making sure you're checking your HVAC, you're checking AC units. We are making sure that we're just taking proper measures. A HEPA filter would be really helpful as well. That's HEPA filter as well. These are good starting steps, but really to make sure you've done it right and you're in a safe environment, contacting a really good certified remediation company. So some other things that we want to do to remove mold exposure. So glutathione is extremely important. So liposomal or IV. So liposomal just means you're taking it orally, but it's attached to a fat ball so we can absorb it better. And IV glutathione is entering glutathione into a vein. Both are going to be extremely important for the removal and the initiation of detoxification of mold. So I would say at least 800 milligrams daily of glutathione. We want to make sure we're consuming fair amounts of fiber so that, again, we're binding molds and the mycotoxins. We're using various biofilm killers, whether it be Baloc or whether it be biocidin, some other things that are really helpful. Glucomannan, that's why I have that on here. Glucomannan fiber is a really nice biofilm killer as well. Here are some other aspects that we should be using, or depending on the specific mold or mycotoxin that you have, some work better than another. So really important to, if this is a major issue, contacting someone who knows about mycotoxin mold exposure and how to treat it is going to be really important. But just to encapsulate everything, some good things to use for mold removal in the body: various probiotics, the main one being Saccharomyces boulardii. N-acetylcysteine is really good. Using bentonite clay, activated charcoal, glucomannan fiber is going to be really helpful. Calcium D-glucarate is going to be really helpful for initiating or preventing beta-glucuronidase to going in and recirculating more mycotoxins. It's to the extent to use prescriptions, you can use cholestyramine. If you're having digestive issues with cholestyramine, using Welchol is another good aspect. With these two aspects, we just want to make sure we're monitoring our cholesterol levels, because these will interfere with some of our hormones and mainly our cholesterol. So making sure we're doing a CMP and monitoring your blood pretty regularly, that things are all status quo when consuming that. When we're doing the cholestyramine and the Welchol, and for your bentonite clays or any of your clays or activated charcoals, making sure we're taking them on an empty stomach 45 minutes away from food and other supplements. We don't want that to bind that. And then to initiate really good detoxification is really important. A lot of times people have phase 3 backup, basically. That means the actual removal or expelling of these mold and these mycotoxins. So using taurine, using glutamine, using glycine, I would start off at about 500 milligrams 2 times a day of all 3 of these, and then you might want to titrate up accordingly, but again, having a professional with you to navigate you through this sticky situation. And then we mentioned briefly about phosphatidylcholine and butyrate. These are really important butyrate's going to be extremely important for the gut, making sure that we've repaired the gut if we've taken it to that extent or been exposed that long that you've had gut issues from the mold and mycotoxins. And we talked about that molds and mycotoxins can get to the brain and actually punch holes into the brain. So using the phosphatidylcholine or some type of choline to help repair that blood-brain barrier, help to repair the phospholipid bilayer that's taken damage. So that's really important there. So again, just to summarize it up for the repair, we want to make sure we're binding. More importantly, first, that we remove the exposure. We're binding molds and mycotoxins. We're using glutathione to help initiate detoxification. We're using taurine, glutamine, glycine to initiate phase 3 detoxification. And if we're having a lot of brain symptoms or issues, using phosphatidylcholine, using butyrate to heal the gut that's connected to the brain and healing the phospholipid bilayer that's in the brain. I hope this was helpful today. If you have any questions, please don't hesitate to reach out to me. And like I always say, I want to be able to give you information and knowledge to be able to make informed decisions on your health. Thank you for your time and have a great day.